So hi again, it's Dr. Lennox Hoyt, fellowship-trained urogynecologist, and we're talking about complications of pelvic surgery. Often I would get a patient coming to me saying, ever since I had my surgery, I've had this or that or this other thing going on. Can complications of pelvic surgery be treated? So let's talk about some of the complications of pelvic surgeries that we see in our practice. One of them can be intractable pelvic pain in the pelvis. Another one can be obstruction of bowels, you having a hard time emptying your bowels since your pelvic surgery. Sometimes pain with bowel movements. Urinary incontinence can be another complication of pelvic surgery. And urinary retention, which means you can't pee at all, can also be a complication of pelvic surgeries. Pain with intercourse, dyspareunia as it's called, can also be a complication that I've seen. All of those complications require, if you feel like you have an issue that you didn't have before your pelvic surgery, pain, difficulty with bowel movements, fecal incontinence or stool incontinence, can't empty your bladder, can't empty your bowels, pain with intercourse. Any of those kinds of complications in the long term following your surgery would require you to locate either the surgeon that did your surgery and tell them about your complications. If you don't feel like you're getting the right answer from that surgeon, it makes sense to go find a qualified, well-trained, experienced pelvic surgeon or urogynecologist and have them evaluate the symptoms that you're having for the possibility that they may be able to help you with those potential complications. Sometimes these complications are time limited. As you heal, things get better. Sometimes they don't get better even after you heal. So my point would be, if you're at the 3-month mark following your surgery and you're still having some of those issues that you didn't have before, it makes sense to get them worked up properly by the proper type of surgeon. So if you're a woman and you've undergone pelvic surgery, and 2 weeks, 3 weeks, 4 weeks, 5 weeks, 6 weeks have gone on, and you feel like you have a surgical complication, the first thing to do is to talk to your surgeon directly. Hey, since my surgery, I've had this situation, I've had pain. The surgeon might say to you, let's see if we can see if this gets better on its own over time. If you're at the 6-week mark, most women are released to go back to regular activities, including sexual intercourse at the 6-week mark. If you're having intercourse and you're having bleeding, you're having pain, you're having trouble emptying your bowels, and those things persist, and you asked your surgeon and they've told you nothing wrong, and you still feel like there's something wrong, then it's in your best interest for you to locate a qualified, well-trained, experienced pelvic surgeon or urogynecologist who can actually help diagnose what's going on with you in terms of how do I explain these new symptoms that I didn't have before. And such a surgeon, such a urogynecologist that's experienced, well-trained, will be able to examine you, evaluate you, do the appropriate testing required to diagnose your situation, and hopefully help you resolve the issues since your pelvic surgery.
So a complication of pelvic floor surgery, it relates to any situation where a patient has had a surgical intervention for incontinence, fecal incontinence, urinary incontinence, pelvic organ prolapse, and that surgery or that surgical intervention has failed, or the surgical intervention has created a situation where the patient is in pain, or she's leaking urine, or she has a situation that's directly related to the surgical intervention that's causing her distress that she needs to have fixed.